what we all came here for. So let me introduce to you our speaker. You may remember her if you attended our other harm reduction webinars in the past. Mira Corey. Corey is a coordinator with the Maryland Harm Reduction Training Institute. Mira has her bachelor's degree in psychology from Morgan State University. She has 6 years of experience with the Lighthouse Studies at Pierpoint and Be Sure, which are 2 harm reduction research programs through Johns Hopkins University. They focus on Baltimore City residents with HIV, STD, high-risk behaviors. Before joining Behavioral Health System Baltimore, Mira was the evaluation coordinator for Wraparound Systems of Care and the National Child Traumatic Stress Initiative. All programs are at the Institute for Innovation and Implementation, which is a part of the University of Maryland, Baltimore. So welcome, Mira, and thank you again for joining us.
Thank you all for having me. Can you all hear me okay?
Yes.
Yes.
Great. Unfortunately, some of my tech was not working today. I had this slide lizard thing that was supposed to be cool, but I couldn't get it to work for some reason. So I'm sorry about that, but I will be improvising some of the discussion. So ignore this QR code to attend right now on your screen. If we can move to the next slide, please.
Oh, you should have control, Mira.
Oh, shoot. Thank you. Ha!
Sure.
I forgot that you gave me these things.
Yeah.
It is that kind of day. Okay. And just making sure it advanced, correct? Does everybody see the agenda?
Yep.
Yes. Yes.
Okay, thank you. I am having one of those days where I'm running all sorts of tech at the same time, and I'm like, I don't remember which controls control what. So let me get in the game. Good afternoon, everyone. I appreciate you so much for being here today. Today, we're going to talk about building resilience in harm reduction. And so what we're just gonna be talking generally, we're gonna do some quick discussions. I wanna get some input from you all. And I wanna talk about the elephant in the room, right? What I mean by that is the things that we don't talk about. I wanna say a few of the quiet parts out loud. Then I want to do some clarifying and defining of terms, identifying some signs and symptoms, and to just highlight some of the resilience factors that you may already be using and didn't even recognize. So without further ado, what is the hardest part of working in harm reduction for you? You can put it in the chat or you can take yourself off mute. If you can give me some input as to what is the hardest part of working in harm reduction for you? Okay, so I hear and see in the chat making time for oneself to take care of themselves, um, taking on the trauma of others, not knowing whether they're making a difference. Um, those are very real, right? Like we are the helpers. We are in a helping profession. Many of us may have been helpers, big brothers, big sisters, um, biologically or voluntarily, communally to folks. We help people. And people like take that for granted. We take it for granted within ourselves, right? We are meant to be helpers. We're in this helping profession, and we don't really take the time to acknowledge like the toll that helping can, have on us, right? And that, and again, I do agree with what I see in the chat. Like it's not just within the harm reduction space. Um, but these are signs and symptoms that you can see in various parts of your life. Um, and we do see this all over our lives, and especially when we are in helping professions and communities, specifically and particularly um, like harm reduction. So thinking more about that, how do those stressors show up for you in the workplace? So that feeling of taking on someone else's trauma, wondering if you know that you're making a difference, like how does that stress show up for you in your work life? So I see depression, fatigue, easily sick, burnout, uh, focus issues. Exactly, exactly. All of these things, right? All of these things are things that we see when we are stressed, especially when we are stressed in the one other location other than our home or some of us for our car, depending on how long your commute is. That the one place we are most of the time, right? Like, and the way that we deal with that, how it comes out, how we act out, sometimes we get snippy or we're just like, I'm calling out today, I can't do it, right? We feel all of those things, and sometimes we don't even know what we feel. We just ain't feeling it. Like you wake up and you go, you know what, today's not the day for them peoples, for the peoples. It's not today. I would be doing I would be doing the world a disservice by bringing myself into the world, and you don't even know why you feel that way. It's just an overburdensome feeling. So when I was saying, talking about the elephant in the room, these are some of the things that I'm talking about, right? These are the things that we don't really get a chance to discuss and explore um, on a regular basis, right? We tend to give a lot of other people room to have those feelings, express those thoughts, um, but we rarely take it onto ourselves, right? And give ourselves that grace. So when we are thinking about the different types of trauma and experiences that we may have, especially dealing in harm reduction spaces or substance spaces or just difficult spaces, some things or types of trauma we may see are participatory trauma, compassion fatigue, vicarious trauma, and burnout. Okay. I've laid these out in a linear fashion, but you can be at several different points on this at every different point, right? Different points of your work career, your work schedule, your life, so on and so forth. It could be co-occurring. So participatory trauma, that results in participating in causing harm or trauma to others. That looks like if you are the person who is in this case, in an example, if you are the person actually having the overdose, or you are an active aider during an overdose, you are participating in that. So that may result in participatory trauma. Compassion fatigue is defined as a profound emotional and physical exhaustion that can develop over the course of time and career. So long-term carers may see that. Vicarious trauma is a cumulative process of observing, experiencing the trauma stories of others and feeling committed or responsible to help them, which can alter one's own well-being. So we mentioned some of that in the chat. You may hear some of that if you are working with emergency medical personnel, hospital, ER personnel, such nurses. You may see a lot or hear about that. And then burnout. And burnout is defined as physical, emotional exhaustion staff can experience when feeling overwhelmed and have low job satisfaction. And we tend to use burnout colloquially in the community to blanket all of these types of trauma, right? All of it feels burnouty, that kind of feeling, but there are different types, and you may experience different types of trauma depending on the situation, the work environment, whatever is going on in your life, in your ecosystem, right? And you can have more than one of these happening at a time. An ER situation is constantly a revolving situation of participatory vicarious trauma and somewhat of compassion fatigue, right? Inundated with people at their worst, on their worst day. Okay. So some signs and symptoms of trauma. Some of these you will notice, they cross lines, right? Meaning they fall in a lot of different categories. They feel similarly, okay? So in participatory trauma, you might experience intrusive thoughts and images, avoidance, thought distortions, mood changes, feeling easily startled. And this is on an individual level, right? A singular staff member, you as your own. These are signs and symptoms. The other signs and symptoms of compassion fatigue, you might notice sadness, grief, avoidance of persons or locations, a reduced sense of empathy, feelings of detachment, having nightmares. Some signs and symptoms of vicarious trauma include anxiety, sadness, confusion, a sense of apathy. Again, some intrusive thoughts and images. With burnout, you might experience fatigue, anger, frustration, cynicism, negativity, withdrawal, right? So, you may feel that sense of being triggered, like showing up after a traumatic event. Like if you have to show up to the building, you get that sense of anxiety, doom. I don't want to be here. I don't want to go in. Or you see someone that produces a response in you and you immediately go into fight or flight. You want to go be elsewhere. or you instantly get an attitude, right? Those are some of the signs and symptoms of trauma and fatigue and burnout that you may be feeling, that you may not understand where they're coming from, but your body, your mental, your emotional system is overrun with all of the things that you feel and see and trauma that you take in every day. Okay. So when we're thinking about signs of trauma and symptoms in the workplace, talking about the organization, the group mentality, some things to look for. What does it look like on a group level? Participatory trauma in the workplace may look like fight or flight workplace triggers, emotional numbing, angry outbursts, and anxiety. Compassion fatigue in the workplace may look like poor job performance, interpersonal disputes, changes in belief system. That's really big. Vicarious trauma in the workplace may look like staff conflict, lack of collaboration, low motivation, and that lack of collaboration, conflict may be a possible burnout contributor. And overall signs of burnout in the workplace looks like cognitive issues. Again, physical exhaustion, belief changes. So in the workplace, across staff, you may see people more call outs, somebody just burning through vacation and sick leave the moment they accrue it, right? You may see people changes in belief system. What does that mean? That means they started out being, you know what, let's help people, let's do this. And over time, you might start seeing them pull back emotionally, feeling numbing, and then going from let's help them, let's help build them up to, well, what's wrong with them? They brought this on themselves. Are you sure they really want help? Oh my goodness, they're back again, right? Like those thoughts, that sense of those core beliefs that got you in the workplace, the wanting to help, the belief in something like in policies and belief systems like harm reduction, changing those at the core, right? Going from we are in this to they are on their own. Okay. Any questions, comments about that? Or questions or comments about personal triggers?
Mira, we have a question. If you could elaborate on the belief systems changes a little bit more.
Sure. So when we start this work, we typically go in positive minded with an uplifting, positive belief system. As you experience trauma, experience burnout, experience job fatigue, you may notice that your views change over time for a negative, and it starts impacting your service delivery. Okay. So we have talked about what the trauma looks like, both individually and organizationally. We have touched on a little bit about what it feels like, right, in that moment, right? We have all been in a what we call a toxic workplace where we're like, look, shift is over at 5. At 3:30, I am already counting down. You know, we've been there. We've been there. So let's think about some of the things that we have done both individually and organizationally to help alleviate some of those things. So I want you to think about your coping skills, your personal coping skills. How do you make it through? And it can be work related, it can be non-work related. What do you do to help take care of you? For myself, I like to do long cooking. So like a long simmer, kind of not really labor intensive, but kind of a set it and forget it um, kind of situation. Um, that gives me lots of steps to ruminate on. I like to dance it out. I see people are saying exercise, music, embroidering, um, D&D. Ooh, yeah, spending time with dogs. All of those. Excellent. Excellent. I encourage you to continue to use these things, lean upon them, and grow your arsenal, right? And not just preparing you grow this arsenal for work related things, but overall for your life. These are things that help to keep you grounded and identifying with yourself, who you are. And I want you to grow with that and sit with that and expound upon that so that you don't get pigeonholed into one coping skill and it starts to lose its dopamine. You know what I mean? Lose its effect. Okay. Thinking about where you work. Are there any organizational resilience strategies or mechanisms that are already in place uh, at your workplace that would help you? Okay, so I see employee assistance program. Um, some ways that is really great and is definitely a wonderful way that some organizations help to support folks. Um, so let's think about a trauma-informed workplace. What does it look like? And what are the aims? So a trauma-informed workplace should aim to recognize the impact of secondary trauma on its workforce. It should aim to recognize that trauma exposure is a potential risk when serving traumatized individuals. And a trauma-informed workplace should aim to understand that trauma can shape the culture of organizations in the same way that trauma shapes the worldview of individuals. Okay? So those are the key tenets of a trauma-informed workplace. So let's flesh that out. What does that look like? So recognizing the impact of secondary trauma on the workforce. This looks like understanding that a traumatized organization is less likely to effectively identify its clients' past traumas or to mitigate and prevent future trauma. So the organizational version of hurt people, right? We've all been into some sort of situation where the whole, like we hear about it a lot, people getting bad medical care, being forced to wait in ERs, and then you sit and you hear them yelling at patients yelling at doctor staff. Like, we've heard this, we've seen this, that type of situation. The people in the situation are traumatized on both sides of the coin. When we are talking about recognizing that trauma exposure is a potential risk in this line of work, what does that mean organizationally? Organizationally, that means that you need to be proactive in developing your capacity to translate trauma-related knowledge into meaningful actions, policy, and improvements. So that means being able to look at the situation, saying, hey, these are potential traumas that could happen in this line of work. So when we're talking about harm reduction, we're talking about potentially witnessing an overdose is something that is a very real situation that someone could see regularly. Having the knowledge and a policy and a procedure in place and practicing those and working with your staff for in those case of emergency situations so that it works as well-oiled of a machine as you can so that you don't damage your staff and don't damage your clients, okay? Because trauma itself is its own sort of damage we can heal from, but we need the skills and we need to be intentional about how we respond, okay? And when a trauma-informed workplace is understanding about how trauma can affect and infect a workplace, the workplace can integrate a trauma-informed approach to help direct the services, programs, and policies and staff development so that we can create a better environment for all involved, front of the house, back of the house, and clients, participants accessing services, okay? These things all work in connection. They help to increase staff resilience, increase staff morale, increase buy-in from the community at large because they feel supported, because they can see that the folks that are interacting with them and that the policies that are being used to help them are actually helping them and are actually seeing them in a realistic way. Okay. Some organizational resilience tips look like providing adequate clinical supervision, including reflective supervision, maintaining a trauma caseload balance, support workplace self-care groups, enhance the physical safety of staff, provide ongoing assessment of staff risk and resiliency. So those are the highlights. Let's look at the details a little bit. So when we're talking about adequate supervision, that looks like having regular one-on-ones with your supervisor to debrief, especially after a traumatic situation, but also building in time into your regular supervision to talk about if you are struggling or if your supervisor is noticing that you are struggling with compassion, fatigue, burnout symptoms, checking in, holding that space and letting someone be able to emote that. Also, offering flex time scheduling whenever possible, allowing people to work as their body and their recuperation cycle can really help people bounce back and feel like they get the rest that they needed and they're being supported. Incorporating a trauma caseload balance. So making sure that folks are not overburdened. We hear this a lot in terms of teachers, right? One teacher, 45 students to a room. That is an overloaded caseload. How is a teacher supposed to be able to manage that? Everybody's got questions, homeworks, all that kind of stuff. So in this arena, managing your caseload, checking in, who is a high priority, like intensive case, and maybe you can lower or rearrange your schedule so that you can do less check-ins with lower priority folks or lower intensity folks, or redistribute workloads. Okay. Incorporate secondary traumatic stress training into your staff development. Create external partnerships with secondary trauma intervention providers. Someone who is a professional who can come in, and maybe they need an intensive service. Maybe you just need someone like this training or other trainings that are available that address these types of traumatic situations. Giving your organization, your staff, space to learn about some of the things that are impacting them in the work that they do. Train your leaders on organizational implementation and assessment. The reason we say train your leaders on that is so that you can make sure that the policies and procedures are not unduly burdensome for both staff and for your clients, and that they are actually getting to the root of what you want to capture or need. Because when you have like unneedingly burdensome policies and procedures, that creates staff resentment, staff burnout. On the flip side, it's like the clients are wondering, why do you need this? Didn't you already collect this? Why is this in triplicate? What do you need this for? That creates distrust, right? And creates a burnout from them, because these might be people who are multi-system impacted. So this is maybe their third, municipal building visit interview of the day. And those things can last 2 and 3 hours apiece. Okay. Think about the safety of your staff and your clients. If you are doing one-on-one interviews, having the staff desk furthest away from the door or closest to the door may or not work for you in that situation. Like, think about how your interview rooms are set up for the safety of all parties involved, right? So these are some things you can think about organizationally that maybe you may have thought about in the impetus, but may need to revisit. Another key to a resilient workplace is flexibility. If you can't be flexible, you will break the backs of your staff. So, some personal resilience tips that you can use in connection with those that are given by your organization. Use your supervision to address actual concerns trauma, and how you're feeling about your job. As an individual, we have a tendency to go into our supervisions and just talk about updates. Yes, I'm working on this project. This is where this is. This is where that is, blah, 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 blah. And we don't really check in with how we're feeling, how our workload is going, how we are feeling about the work. Do we need a break? Use your supervision time to really focus on what you need to focus on. Remember, your supervision is your time. That is your time. Increase your own self-awareness about secondary traumatic stress. Check in, learn what that means for you. What does that feel like for you? So that you can send up an alert within yourself and within your community, who helps keep you in check, right? Try to maintain a healthy work-life balance. Again, easier said than done. I fall short all the time. You saw me scrambling this morning or this afternoon trying to get the rest of get this tech part in for this training, right? That's because my work-life balance was thrown off in the moment because I thought I had that part down. Didn't. Everybody's human and we will fall short. Take time off, rest. In America, particularly, we feel like rest is something that needs to be earned. You don't need to earn rest. It is not a reward. It is something that you need mentally, emotionally, and physically to be your best self. I see in the chat, someone mentioned rest is resistance. Yes, think about it. Being able to take space for yourself, to take rest for yourself, is an act of resistance because you are advocating for yourself and challenging the status quo of you need to earn it. You don't. You just need it. You do. Try to use exercise and good nutrition. Again, easier said than done, because especially here, at least in Baltimore, Baltimore is a delicious city. It is easier to find something delicious and maybe not so healthy for me on a day when I am overly stressed. But still, I am nourishing my body. I am feeding my body what I need. And I move my body. We mentioned earlier when we talked about individual resilience, moving your body can look like a lot of different things. It can look like hiking. It can look like dancing around in your living room. It can look like walking around your apartment doing laps. It can look like walking up and down the steps, right? Something to get the blood pumping, to make all the chemicals spark up again, right? Get your body, get your blood going. Practice self-care. That is a loaded statement because self-care has a tendency to have dollar signs attached to it, right? People think self-care is equal to shopping or massages. No, self-care looks like I am going to take an extra hour of sleep today because I need it. It looks like I'm going to take that nap. Self-care looks like I am going to add the bubbles to my bubble bath. I am going to read an extra chapter of my book instead of forcing myself to go to bed when I need to, right? Self-care really is about giving yourself the space to be you, to rest and recuperate, and to do what you need to get yourself back to you, or at least get yourself back on the path to you, right? You can help to keep on top of these things in a lot of different ways. And a lot of these things you are already doing. And the basis of this training is to really highlight the things that you are already doing, right? You are here, you are doing it. And I mean that individually, and I mean that organizationally. This training is to really shine a light on those things of what you're already doing, and also to shine a little bit of light on areas where you might want to improve, right? Where you can be flexible, where you can make suggestions to change policies, right? That's what this is for. Because really, you guys are already doing it. I'm just reminding you, and I'm giving you permission to rest. Because sometimes in this world, all we really need is someone to give us permission. Okay. So some ways to keep on top of your resilience strategies are maybe a buddy system. Could be somebody at work, could be on a different team, your work bestie. It could be a colleague at another organization that you have made a good buddy system with. We've talked about utilizing the employee assistance program. We have talked about all the different types of training that you could utilize. All of these things are available to you. You have them in your pocket. You just need to not be afraid to use them. So now I am opening up the floor for questions and comments. Any questions, comments, anything anyone wants to uplift? In the slides, you will find a lot of resources to get you started on both workplace, organizational, and individual resilience building options and help.
Looks like we have a question and a comment question.
Okay. So I'll start with the first one. It looks like it said, the question is, how do you deal with the shame of not working? And I just want to ask for clarification. Are you talking about not working as in I took a day off, or not working as in sustained unemployment for whatever reason? Okay. All right, for both. So talking about the short term, meaning taking a day off, taking time for yourself, short term, whether that be an hour or maybe you take a sabbatical for like a month. There will be people that make you feel shame for taking time for yourself, right? You may feel that externally, right? Because we have all been conditioned to feel that way because, like I said, America deems rest as something that you have earned. And if someone feels that you haven't earned it, they will shame you for it, right? There's stigma attached to that. Sitting with that and knowing that that may be uncomfortable, but pushing through that and explaining not only to yourself, but to others. I cannot be my best self. I cannot be my best worker, my best friend, my best partner, my best parent if I do not take space for myself. There is no shame in taking space for myself. I want to be the best me for you and for me. And expressing your needs and giving it, the more that you advocate for yourself, the easier it will become. It's going to itch like a wool sweater in the middle of the summertime, especially if you're someone who, like me, deals with people pleasing. But the more that you advocate for yourself, the more comfortable it will become. Pair up with someone in your life that helps, that you already know does that for themselves, already is good at advocating, and be like, teach me, Obi-Wan. Have them start off as your accountability partner or your self-care partner. The next question is, do you have any recommendations for how to approach establishing a trauma-informed workplace? So there are lots and lots of different resources, and some I have listed here on helping to create a trauma-informed workplace. So developing self-care plans and workplace organizational assessments to assess the trauma or potential trauma, um, potential policies that may be enforcing trauma or perpetuating stigma or trauma for folks. Talking with your staff, working with organizations that are very focused on alleviating a secondary traumatic stress workplace and helping you build those policies and procedures. You can find these organizations. There are lots of trauma-informed specialists, organizational specialists. Excellent. I am here to get you started and send you on the right path. I can help point you further in the right direction. You can always reach out to me for more intensive or more directed help and resources. I'm not sure if that answered either of those questions fully. I hope that I did. Okay. And so the evaluation link for today's session is on the slides and will be in the chat and will be sent out to you later. If you would like to reach out to me, I am putting my information in the chat. And that email reaches a team of 4 folks, and we will help you as quickly and as thoroughly as we can. And if you have any other training or questions regarding harm reduction, please feel free to reach out to the Maryland Harm Reduction Training Institute. We would love to assist you in any way that we can. I hope today was helpful. I hope today got you thinking about your own resilience and your organizational resilience. And hopefully this helps you to get started on opening the conversations, both individually and organizationally, about creating a healthy and helping workplace. that's my time for today.
Yes, thank you, Mira. As always, you put on a great presentation. There's a couple thank yous in the chat. There's some more coming in. For those of you who are interested in the subject matter, we are having another webinar. It is the language of harm reduction. Is that correct? Okay. And we are hosting that one for Health Literacy Month, which is next month, if y'all are not aware. So help come celebrate by learning some new information. And Mira, again, will be our presenter for that as well.
Thank you so much, everyone. I really appreciate your input and your time today. And this helps build my resilience, because sometimes I don't get out to talk to folks much, and I miss it. I miss being in community with folks. So thank you.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.